Hello and welcome to Monday's Agenda. In today's program, we'll be talking about the health sector and with a focus on addressing challenges facing number of deaths of maternal and newborns in Tanzania. My guest is National Coordinator, White Ribbon Alliance for Safe Motherhood, Tanzania, Mlay. First of all, let's talk about the work of the White Ribbon Alliance in Tanzania, the background and the focus areas that you have in Tanzania. And is this different from the Red Ribbon?
The White Ribbon Alliance in Tanzania was launched here in the country in 2004. The right of women, pregnant women in Tanzania, be safe during pregnancy, childbirth, and 42 days after delivery, them and their newborns. That is our vision, that all women to be safe. It is their right to be safe during pregnancy, childbirth, that is when they are giving birth, and 42 days after delivery. Because this is the period we call maternal health, and if they die, we call it maternal death. And if they're newborn, we call it newborn deaths. So it's a critical period because during pregnancy, anything can happen. During childbirth, anything can happen. 42 days after delivery, anything fatal can happen so that the mother or the newborn dies. So our vision at the end of it all is for each and every woman who conceives to celebrate childbirth. That is our vision. And our mission, of course, is to make sure that we come together as advocates to work with the government, the decision makers, the policy makers, to ensure that there is a policy that addresses this issue, and also there is a specified budget for these women to be safe because it is their right. Let us make sure that know that a pregnancy is not a disease. It's not a disease at all. It is a process of health, bringing another person to the world does not require somebody to die. So it is really a scandal for someone to die. Here in Tanzania, 24 women die every day. 24 women die every day. Today, I was reading a message from from the Deputy Minister for Health, and he was saying himself, he said that some of them, he heard from parliamentarians that they were told by advocates that it is like the minibus overturning with 24 women. But I can add also, for each woman who died, there are 6 newborns who die, making a total of 144 newborns dying every day. So we lose how many lives? We lose 168 lives every day. Each and every one of us was born. We were very delicate. We were brought up by our mothers. So the newborns and the mothers have the right to survive, to live like another human being, because pregnancy is not a disease like malaria, HIV, or cancer. We all get all these diseases, but the process of childbirth is a healthy process, and no woman should die. One woman dying is one too many. So that is the problem. 24 women dying every day, 144 newborns dying every day, making a total of 168 lives being lost. And that means every year from 1990, we have observed 8,000 women dying every year. Every year. 1 year, as it goes, 8,000 women die. Another year, 8,000 women die. Until today, And whenever even politicians are presenting their speeches in the parliament or anywhere else, they will say, we have done well in reducing under 5 deaths. We have done well in ensuring the roads are better. We've done well in ensuring schools are better, as you can see in the campaign today. But when it comes to mothers, or what we call maternal mortality, they will say we have not done well, because the numbers are constant since 1990, when we learned about this data from DHS. So it is a problem, and it is a chronic problem. So for us, White Ribbon Alliance and stakeholders, including people from the Ministry of Health, from Ministry of Finance, from the local government, we discussed in one meeting and said, what is the problem? What is the root cause for this problem that so many women are dying, and there is no relief? And we all agreed. I mean, there were like 40 options. There is this problem, that problem, this problem. But what is the root cause? We found out that there is gross underfunding of comprehensive emergency obstetric and newborn care. There is gross underfunding of comprehensive emergency obstetric and newborn care. And in short, we call it CEmONC. So this CEmONC is a proven approach to eliminate maternal death if a woman is experiencing complications. And I will clarify. It has been found that the direct causes of mothers dying during childbirth is hemorrhage, that is severe bleeding, or even bleeding during pregnancy. A woman is not supposed to be bleeding during pregnancy at all, but if she bleeds, that is fatal.
Bleeding, is it bleeding during the process of giving birth or bleeding before?
Bleeding before is not like, it shouldn't happen at all. Excessive bleeding after delivery, that's what we are talking about. When the baby is born, the uterus was extended for, the uterus is the womb where the baby was sitting, and there is what we call placenta. It was attached to the wall of the uterus. So when the baby is born, the placenta peels off and the area is left open. It's like open. So the uterus has to contract very much so that the blood vessels also close. But when there is a problem and no one can tell that this woman is going to experience that problem, even if it's a rich person, even if they were eating very well, even if they attended antenatal clinic, this is a clinic where they check pregnancies, even if they were attending, it can happen to anybody during childbirth or immediately after childbirth. So this is severe bleeding. And this severe bleeding, because all the blood vessels are open, if the uterus is not contracting well. So the bleeding is like you open a tap of water. And you know that we have only 5 liters of blood. So if you open a tap of water, if you are filling maybe a container with a 5 liters container with water, you can see how fast it goes. So if you are pouring out, it goes really fast. But for us as human beings, if the blood is coming out so fast, there are also some chemicals that goes with it. And these chemicals were supposed to help clotting. So if you come to give blood later, maybe after 2 hours, it won't clot. So the woman continue to bleed even when you are giving blood if you didn't start on time. That's why we say it is an emergency. It is emergency. And there is nothing you can do. You have to give blood. and it has to be immediately, maybe within 5 minutes, within 10 minutes. If the woman survives for 2 hours, I don't know, it will be a miracle. So within 2 hours, she's dead. That means she cannot be transported from one place to another and be safe. Unless you have like maybe flying something, because we know how things are. You call it ambulance, it will go, it will take time to come to the place, and went to the bigger hospital. It is really a problem. That's why we are saying that women, the government actually recognized this, and they said 50% of health centers should provide comprehensive emergency obstetric and newborn care so that the women get treatment on time. 50%. That was in 2008. And they said by 2015, all the health centers, 50% of health centers should do that. But as it is now, only 16% of health centers are providing CEmONC. So women have got to be transported to a hospital which is like 5 to 7 hours away. So you can see the situation. If the woman is bleeding, they either die in that same place, or they die on their way, or they die on their arrival. So that is one thing, bleeding. The other one which causes women to die is what we call eclampsia. The woman is fitting like an epileptic person.
Is this prone to, again, to any woman, or is it prone to...
You can never tell. These problems, you can never tell it will happen to this woman, that woman. That's why it's very important to make sure that all women are giving birth to places where these services are available, or to a very near place, so that when the problem occurs, they can be rushed there. Within 5 minutes, they are there. So eclampsia, the woman is fitting. So they are given a medicine called magnesium sulfate by injection. It calms them down. It treats the eclampsia. But some of the situations in eclampsia persists. The woman keeps on fitting, and the baby is suffering from lack of oxygen in the womb, and she continues to fit. There is nothing you can do. The only treatment is to do an operation.
The fitting or the seizure that you're talking about,
yeah.
is it a brain thing, or is it?
It is high blood pressure. Of course, it affects the brain. Electrical impulses in the brain, and the woman is fitting, just like eclampsia, because the high blood pressure is very, very high. So some of them, like I say, they cannot be treated with the medicines only, but they also need a surgery to remove the baby. That's why eclampsia, a patient with eclampsia, a woman with eclampsia in a dispensary, they can get the magnesium sulfate, but sometimes some of them may not calm down, may not get well until the baby is removed. That is the end. That is the only solution. Once the baby is removed, that's it. They get treated, but it has to be very fast, and the baby in the uterus die very fast. So that is another thing, eclampsia, requiring a health facility which has got theater and qualified staff. We talk of qualified staff. This is a midwife with competency. A midwife who have trained